Well, of course, the first thing you need to know is what the actual diagnosis under the microscope is. What the pathologist tells you is the kind of cancer it is. That's obviously clear. Secondly, you need to know in a lot of cancers, not all, but a lot of cancers, you need to know how far the cancer is spread. Is it localized or is it spread around the body? Because treatments are different there. But increasingly, the treatment assignments are based on what we call prognostic factors, which are things that we can determine about that tumor or about that patient at diagnosis, which now we know tell us whether that child has either a better or worse chance to respond to a given therapy and whether they need different therapy than we would normally give. These are called prognostic factors. And in leukemia, for instance, there are things like how high the white count is, the white blood cell count is, or how old the child is, or what are the immune characteristics, the proteins on the surface of the leukemia cells, or what do the genes, the chromosomes in the tumor, in the leukemia look like. In the solid cancers, it has to do often with the molecular components of that cancer. We can now take a cancer cell and find out exactly what are the genes that are in there and what are the abnormal genes. And there are certain patterns or amounts of abnormal genes that can tell us whether a patient needs relatively standard therapy and will do very well, or whether that patient needs much more intense therapy or new therapy or a specific therapy that meets that particular cancer's needs for treatment. So it really has gotten quite complex to decide how to do this, but it means that it's very, very important for a family to have their child seen and be treated at a major cancer center, because you have to have all of these things available to look at, to examine in the tumor and in the patient. And only the major centers have this sort of ability to do this. So that's really one of the critical elements here. In this increasingly complex world where it's not just how far the cancer's spread or what looks under the microscope, but what are these genetic and immunological and other factors that can determine how we should treat this, that you're at a place that can give you those answers, that can do those tests, that can tell the doctor, okay, here's the pattern, here's what you need to do to treat that child.